So I'm here with Bill Badham from Practical Participation. Bill, can you tell me a little bit about capturing young people's stories and how to make those stories possible in terms of improving children and young people's access to psychological therapies?
Yes, and it's at the heart of it, because unless they can tell us that things are better for themselves, then the rest of it's been a waste of time, though we may have felt good. Way back in 2003, we'd worked around models of organisational change using Here by Right, which is all about the organisation improving how it listens. And then someone said to me, but that's not it at all, and I froze in panic. And what he was pointing out is that just because an organisation we can show is involving young people in recruitment and in the budgets and everything else, it doesn't of itself say that things are better for them in their own lives. So what we did was simply say, we need the stories, we need, yes, we need the evidence of the organisational bit, but then we need to show how that's changed, transformed the organisation so that the children and young people using the service are saying they're getting a better deal. And how we did that, Joe, was simply saying, so tell us your story of how you were listened to, what happened as a result, and what you would describe as the change resulting. And while if you're the worker, you telling me that story is great, someone over there telling the story is great, but actually the person who's meant to benefit, what do they say? And they might be able to tell you that they were really listened to or a lot happened, but can they tell you that something's better for them as a result? And if they can't say that, then we as professionals, workers, should go, whoops, we've done all this stuff, but actually the young person saying nothing's better. On a positive note, you get those stories, and you call them anecdotes if you like, but there is the absolutely strong evidence that we listened, we acted, and the people who are meant to benefit are saying that they have, and that's magic.
Brilliant. And can you tell me, what is the evidence actually telling us within mental health services now?
The evidence is mixed, but getting better. There is clear evidence that managers and practitioners, clinicians, recognise that if we don't listen to the child and young person in front of us as well as a sort of collective voice, then we're not going to get the service right. There's probably still a little bit of sort of professional I know best in the system, and what we're hearing from children and young people, both in sort of more acute services and generic, whether it's residential, on a ward, or in a community facility, that they're saying that actually things are better for me, I feel better, I'm better connected, I feel more, they wouldn't say the word resilient necessarily, but I'm stronger inside, because I actually have had a better deal and a better service. And
what has happened to make those services better for those people?
Well, what we do know is it tends to need to happen at three levels. If you think of, if you like, a building, the top level of the building with its small but crucial bricks, we could use as the picture about practice. So it's the direct practice, the clinician seeing someone, the nature of the assessment that they've got. It's a sort of holistic approach. If things aren't good, the young person feels, if you like, at an organisational level of bricks, the middle, that they can complain, or there's independent advocacy, that they feel that they can take part in the recruitment of workers, for example, that they feel they can influence the sort of supervision and appraisal process. And then the chunky big bricks at the bottom of the building are telling us that children and young people feel they need to witness in the leadership of the organisation a commitment to the involvement of children and young people, and that is expressed through some sort of promises or pledges or mission charters that sort of, describes what this leadership is saying, how they want to involve children and young people and take their voice seriously. So what we know is you can have different bricks, if you like, Joe, but you do need them at those three different levels of the sort of strategic, the sort of leadership bit, the putting it into operation in the organisation, its policies and all that stuff, and crucially at the practice level.
Okay, thanks very much, Bill.
Thanks, Joe.